Yes, so CPAS exists for 20 years now in the US and have been quite active in Europe since the last 15 years already. More informally at the beginning, being involved in regulatory procedures such as the development of the qualification procedure, or even in collaboration with the FDA and having a parallel procedure. And over the years, CPAS have been importing the regulatory science approach to drug development in Europe, and had the opportunity to open an office in London next to EMA originally, and with the Brexit move has now an office in Amsterdam where the European Medicine Agency is located. And we are now working proactively with the European Medicine Agency in a way that we can facilitate the global collaboration in high unmet need area and facilitate at least if not harmonization of strategic priorities, but deliver programs and outcomes that are fit for the two regions. Yes, the office in Europe of the Critical Path Institute has as a mission to develop regulatory science in a global landscape, meaning that we are aiming at synergizing activities in similar areas that we have in US in consortia that for some of them exist for a decade and have gathered data and developed tools that have been validated by the regulatory authorities. But also we are working more at European level in some aspects, like the rare disease moonshot, where we are importing the learnings of regulatory science in areas in need in Europe and where we are collaborating. These areas are mainly the rare disease space. And we are also involved in activities such as the IMI, pre-competitive projects, and CPAS, the team in Ireland, is actually well involved in the tuberculosis space. So the CPAS is focused on the two main core competencies in Europe, which are at the moment regulatory science and data collaboration center. We have about almost 10 people in Europe, with a team in Ireland of data scientists, data manager and data engineer working in a tuberculosis project and soon to start in rare disease projects and programs. And we are also working at regulatory science with our board and experts linked to CPAS for a long time, such as Graham Hickson, who is interacting with IHI to integrate regulatory science aspects. To have our foot on the ground in Europe allow us to connect with communities such as the rare disease communities, but also experts in areas where CPAS is engaged more easily, and therefore help the communities to understand how can CPAS address some of their unmet needs that might be either specific to regional aspects, but also bring together on CPAS platform the European perspective and needs and identify what are the common areas and challenges that can be tackled at global level. Yes, so over the recent years, CPAS has also engaged with the World Health Organization in pediatric programs, which is a population that require truly engagement from every organization and every regions. And therefore, we are looking at expanding, of course, to other regions. We have some of us at CPAS experience it in ICH, which is the International Conference of Harmonization, and we do know that when Europe and US are aligned, that helps really to advance and overcome challenges in other regions. So we are engaged, some of our consortia are engaged with Canada, for example, UK, MHRA, and hopefully soon with other regions such as Africa, South America and Asia, also depending on the opportunities, regions where we would like to help.